And for more on the Ebola epidemic, we're joined here in our studio by Dr. Joel Selanikio. He recently returned from treating patients in Sierra Leone, and he is the CEO and co-founder of Magpi, a provider of mobile data collection apps. Thanks for being here and welcome back from Sierra Leone.
Thanks for having me, Susan.
Must
Great
have
to be
been
back.
an incredible trip.
Yeah.
Tell us, how are people contracting the disease for the most part? Just through living in villages next to their neighbors, their children, or through the burials?
Well, through any situation in which you might have contact with bodily fluids, and what that has meant has been when people get sick and they're cared for by their loved ones, the people are sweating, sometimes they have bleeding, sometimes they're vomiting, having diarrhea, and unfortunately people come in contact, the caregivers come in contact, then the caregivers get sick and the cycle continues. Likewise with burials, with dead bodies, people come in contact with the bodily fluids and then the virus is able to spread.
Tell us about your time over there. You led a team of doctors. Tell us about your work and what the biggest challenges were for you every day.
Well, I was with a group called the International Medical Corps, IMC, and I was the lead doctor at a place called Lunsar, the ETC, or Ebola Treatment Center at Lunsar. And we had a capacity of about 50 beds. And we had a capacity of about 50 beds. We never got up above about 30 patients in the facility because the cases, as you know, are starting to come down. And honestly, the biggest challenge is, I thought the biggest challenge would be just dealing with our own fear, wearing the PPE suits, working in a hot clinic. And in fact, really what the biggest problem was, I think, was just the fact that the mortality rate is so high that it's very emotionally draining dealing with people who are very sick in the first place, but then when essentially most of your patients, despite the best care you can give them, are dying, that's, it's just hard to keep going. But obviously you have to.
I see. They're saying now that the number of Ebola cases is down in West Africa, in the three worst affected countries. What do you attribute that to?
Well, I think part of it, of course, is just efforts on the part of the government, nonprofits, UN agencies, US government, just to break the chain of transmission. So, for example, even though we had the usual high rate of mortality at our ETC of 60 to 70%, probably, they're still compiling the statistics. But in other words, many people die even when they're brought to an Ebola treatment center. But one thing they don't do is they don't spread Ebola to other people. So even bringing people into the treatment facilities helps to break the chain of transmission. And this has been going on, as was pointed out a moment ago, for about 10 months now, where people have been working endlessly, ceaselessly to break this chain of transmission. I think we're starting to see a payoff. What
do they need there most? Money, education, all of the above?
Well, honestly, I think that resource-wise, I think they have most of what they need. And again, I think it's starting to bear fruit. We're starting to see the cases drop off, in some cases, pretty precipitously. Which is terrific. I think now people are trying to think about, well, what's the next stage? What do we do with all these facilities that have been built once we have actually managed to put Ebola to rest? Can they be used as other health facilities? Can they be used as schools? What's safe? What's advantageous? And I think people are starting to look kind of beyond Ebola in these places.
What about the vaccines, the latest ones? Are they effective?
Well, they're still trying to figure out whether they're effective. When I was in Sierra Leone, we thought we might actually be volunteer testees for one of the vaccines that CDC was working on, but we never wound up getting injected with it. I think it was pretty amazing that essentially every healthcare worker that I was working with, when they suggested we get the vaccine, everybody said, sure, I'll take it. Okay. I'll just step forward and volunteer.
You're a strong advocate of technology and medicine. Obviously, you have your company, Magpi.
Sure.
What's happening on those fronts in the fight against Ebola?
Well, we were using pretty basic methods at the ETC where I was working, but I can say that certainly many organizations are using, especially mobile technology, all across West Africa, in many cases using our own Magpi technology, in some cases using other technology. But people are using, for example, mobile phones as computers to do things like track burials, to keep track of lab results, to do case reporting from the field and contact tracing. I mean, if you don't think of it as a phone and think of it more as a computer, well, what could computers be useful for in the massive effort like this? Lots and lots of things. So we have, for example, the Federation of the Red Cross, the CDC, U.S. government. All of them are using our technology, and I'm sure some other technology as well.
And tell us about, real quickly, well, not real quickly, but as quickly as you can, the human aspect of it all and how families are being divided, and we're hearing about these orphanages everywhere. How are people coping?
I mean, honestly, it's very difficult. And, you know, I remember I saw this as one of the doctors at our center. We were asked when families came to essentially pick up the body of a relative or the personal effects of someone who had died, we were asked to be there and to speak briefly with the family. And, you know, even that, you know, I remember the first time I had to do that, there was a guy who came as a representative of the family. He was about 17 years old, dressed, you know, with a hat, baseball hat with the brim backwards, wearing a T-shirt, very, you know, very 17-year-old looking, and didn't seem to be paying much attention. And, you know, we explained that we had done the best we could. And, you know, he's kind of sort of paying attention, and then he just completely broke down into tears. It was his father that had died. And you realize that, you know, how are people coping? The best they can. In many cases, we had many patients, many surviving patients, who had lost all or most of their families. How will people deal with that? I guess they will the way people always do. I mean, one day at a time.
All right.
Yeah.
Dr. Joel Selanikio, we thank you for your time and
Sure.
obviously your work over in Sierra Leone.